The Committee on Public Health and Human Services will come to order. I will recognize that we have a quorum in the presence of Councilman Greenlee, Councilwoman Cindy Bass, Councilman Nielsen, and Johnson, and yours truly. And we will ask the clerk to please read the bill.
Bill number 140517, an ordinance amending section 10-602 of the Philadelphia Code, known as the Clean Indoor Air Worker Protection Law, by providing for a limited period of time during which certain private clubs may apply for and obtain a waiver of the provisions of the section prohibiting smoking in certain places under certain terms and conditions. Bill number 140635, an ordinance amending section 10-602 of the Philadelphia Code, known as the Clean Indoor Air Worker Protection Law, by providing a limited period of time during which certain drinking establishments may apply for and obtain a waiver of the provisions of the section prohibiting smoking in certain places under certain terms and conditions. Bill number 140649, an ordinance amending section 10-602 of the Philadelphia Code, known as the Clean Indoor Air Worker Protection Law, by providing a limited period of time during which certain drinking establishments may apply for and obtain a waiver of the provisions of the section prohibiting smoking in certain places under certain terms and conditions. Bill number 140886, an ordinance amending section 10-602 of the Philadelphia Code, known as the Clean Indoor Air Worker Protection Law, by providing a limited period of time during which certain drinking establishments may apply for and obtain a waiver of the provisions of the section prohibiting smoking in certain places under certain terms and conditions.
Okay, good morning. We have a panel from the administration's panel. We would now call Dr. James Bueller, who is our health commissioner. Next, after that, we'll call them as they come up.
Good morning.
Good morning.
Thank you, Chairwoman Tasco, for the opportunity to be here today with you and the other members of the Public Health and Human Services Committee, and for giving me the opportunity to provide testimony on these four bills, 140517, 635, 649, and 886. All four of these bills...
Would you identify yourself?
Oh, I'm sorry. My name is Dr. James Bueller. I'm the Health Commissioner for the City of Philadelphia. All four of these bills would grant specific establishment and exemption from our city's Clean Indoor Air Worker Protection Law of 2007. 3 businesses are seeking exemptions under the drinking establishment or bar waiver. 2 of these 3 businesses operate as gentlemen's clubs. The 4th entity is seeking exemption as a private club. Respectfully, as Health Commissioner, I must oppose all 4 bills, just as I did in December 2014 when they were first introduced. I commend the committee for its wise decision to hold those bills then, and I respectfully encourage you to do the same this time. I want to make 2 main points today. First, I want to highlight the purpose behind our smoke-free law. It was designed to protect workers and the public from secondhand smoke. I see it as part of my job to ensure that Philadelphians do not have to choose between their health and their employment. I know this is a concern shared by many members of Council. The recent progress of a mandatory paid sick leave bill in this body is only the most recent demonstration of Council's commitment to worker health and well-being. Second, continuing to whittle away at Philadelphia's smoke-free law will further jeopardize the city's chances to host major health-related conferences and the millions of dollars in economic activity that these events bring with them. It's a fact that secondhand smoke is toxic. Exposure to secondhand smoke increases the risk for and can cause cancer, heart attacks, emphysema, and strokes in non-smokers. as reported in the most recent Surgeon General's report. Levels of secondhand smoke in bars can be 2 to 6 times higher than in homes where people smoke. Every worker and business patron, including those of bars and gentlemen's clubs, deserves protection. Philadelphia's Clean Indoor Air Worker Protection Law prohibited smoking in bars, restaurants, workplaces, and other indoor spaces. It did, though, include some exemption provisions. They were meant to provide a one-time waiver application period for small bars and private clubs in existence at the time of the law's passage 7 years ago. The waiver period was never meant to be reopened. Waivers were a compromise to ease the transition to a comprehensive, progressive law that protected employees, customers, and members of the public from secondhand smoke to the greatest degree possible. By granting new waivers now, a time-limited circumscribed compromise grows bill by bill into a larger and larger loophole. One bar and one private club obtained exemptions through a similar legislative amendment process in 2011 and 2013. Today we're considering 4 more exemptions. I worry about how many more will be added in the future. Moreover, I note that 3 of the 4 entities seeking exemptions today actually applied for waivers in 2007 but were ineligible. The time for eligibility is now long past. The 2 gentlemen's clubs seeking exemptions may argue that they are at a competitive disadvantage because most other such clubs have exemptions that allow smoking. However, currently only 4 gentlemen's clubs in Philadelphia have smoke-free waivers. And a quick review suggests that at least 9 other similar clubs operating in Philadelphia today don't have such waivers. It may seem that a few more bars or a few more gentlemen's clubs that allow smoking is no big deal. But let's think about the workers and the non-smoking patrons of these businesses. The Clean Indoor Air Law was meant to protect people, no matter where they work, where they go to dinner, or where they have a drink, from the harms of secondhand smoke. Private clubs are no exception because the indoor law currently defines a private club in a manner that allows these establishments to have employees. If you have workers, the law should apply to you. In sum, the law was a good idea when it was originally passed by the council, and is still a good idea for all the same reasons. As health commissioner, I sit on the advisory board for the Life Sciences Division of the Philadelphia Conventions Bureau, and you'll be hearing more, I believe, from a representative of that organization later. In this role, I've learned that creating more exemptions from the smoke-free law puts Philadelphia at risk for losing health and life sciences conventions. Such conventions account for approximately half of all conventions in the city. 27 health organizations, including the American Heart Association, the American Lung Association, and the U.S. Centers for Disease Control and Prevention, will only host conferences in cities with comprehensive smoke-free laws that limit exemptions to the greatest degree. Cities like Chicago, New York, Los Angeles, Boston, Newark, and Baltimore. These are our competitors, and we're in a precarious situation. Take the American Heart Association as a case in point. It recently announced that it will be hosting its 2019 annual conference in Philadelphia with 25,000 attendees and approximately $68 million in economic impact. Yet representatives from the Convention and Visitors Bureau noted that Philadelphia almost lost that conference because of our existing smoke-free exemptions. Rightfully so, the Heart Association had questions about the scope and the nature of the exemptions and expressed their concerns. Ultimately, Philadelphia was successful in winning the convention, but it was a near miss and could become a complete miss as the Heart Association continues returning to Philadelphia for future meetings. Therefore, just as in December, the Convention and Visitors Bureau has submitted a letter in opposition to these bills, and I believe a representative from the Bureau is here as well. I respectfully say to each sponsors and to the members of this committee that holding these bills is the right thing to do, not just for the public's health, but also for the city's financial health. In so doing, you will strengthen our competitive edge in attracting major profitable conventions from the health and biomedical industries, and you will prevent numerous employees and patrons from suffering the harms of secondhand smoke and the debilitating diseases it can cause. Thank you for your consideration today. I'm joined by my colleague, Dr. Giridhar Malya, who directs our Get Healthy Philly program, and Dr. Malya and I would be happy to answer any questions that you might have.
Thank you very much. Are there any questions on behalf of the committee?
Yes, Madam Chairman. You talked about comprehensive laws compared to other cities. Where does our law sit compared to cities like Chicago and stuff like that? You said, do you believe that ours are weaker than theirs, or?
We're roughly in the same ballpark. Our exemption provision is a little weaker, particularly with respect to private clubs. Other cities have private club exemptions only for clubs that have no employees, where all the functions of the club are maintained by club members. Would you care to add to that?
Yeah, just one other point. I think in addition to private clubs, as Dr. Buehler mentioned, all those other cities don't allow exemptions for small bars. And I think that's a key distinction between Philadelphia's law and the laws in those other cities as well.
Does the administration feel that all the businesses in the city should be treated equally? It sounds like, it's a fair question, because what we have before us today are some facilities, some private clubs that were unable to produce the documentation in a timely manner, and they're at a disadvantage from the other facilities like themselves. Do you believe that we should treat all businesses equally, and that's simply, Doctor, a yes or no? Great.
Right. In an ideal world, all would be treated equally and there would be no exemptions.
Thank you, sir. No more questions, Madam Chair.
Thank you very much. Any other questions, comments? Thank you very much.
I do have one quick
Councilwoman
question.
Bass.
So, Dr. Malaya? Yes. So you just said that other cities don't have any exemptions for small bars. And so there's no food, like the waiver if you're selling less than 10 or 15%, in food sales. So you're saying there's no waivers for that?
Yeah, we in Philadelphia have approximately 50 to 60 small bars based on the definition in the Clean Indoor Air Law that were given exemptions.
Could you speak up, please?
Sure.
To the mic.
We have approximately 50 or so small bars or drinking establishments that were given waivers here in Philadelphia back in 2007, and that is different than in other cities. So that happened in Philadelphia, but that provision isn't available in the Clean Indoor Air Laws of other large cities.
Okay, thank you.
Good. Any other questions? Thank you very much for your testimony, Commissioner.
Thank you very much.
Thank you.
Next, we have Dr. Kenneth Margulies. And it's Deborah Brown from the same, from the American Lung Association.
Well, good morning, Chairwoman Tosca and members of council. I'm Dr. Ken Margulies, President-elect of the Philadelphia Division of the American Heart Association and a cardiologist at the University of Pennsylvania. The American Heart Association is joined by many health advocacy partners, including the American Cancer Society and the American Lung Association, in urging council to defeat and reject the legislation before this committee today, which proposes to open new exemptions in Philadelphia's Clean Indoor Air Worker Protection Law. The members of this committee and the City Council understand that secondhand smoke is dangerous to human health. We came before this committee in December in opposition to these proposals, and this committee wisely chose not to advance these misguided bills. Echoing the comments made by our health commissioner just moments ago, the legislation in question creates an impossible choice for Philadelphia's workers today in a tough economy. whether or not to go to work in a smoke-filled environment that may kill them. Philadelphia's workers shouldn't be forced to expose themselves to a toxic and harmful environment in order to have a job and a paycheck. Nothing about the science on the deadly effects of secondhand smoke has changed. Less than a quarter of Philadelphians are smokers, and the vast majority of Philadelphians don't smoke and don't want to be exposed to secondhand smoke. And perhaps most compelling from our perspective is the fact that the American Heart Association implemented a strengthened smoke-free meeting policy last year, and many large organizations, particularly in the health and science sector, have followed this lead. Additional exemptions like those under consideration will jeopardize the city's ability to attract large meetings sponsored by the American Heart Association, American Stroke Association, and other major health and science organizations. Tourism and conventions are an economic engine for this city and will remain so, or we want them to remain so. It's senseless to jeopardize this economic driver. Again, in my opinion, this committee shouldn't merely hold these bills. These bills should be rejected, and rejected for good, for the health and economic benefit of Philadelphians. Thank you for your attention.
Thank you very much. Ms. Brown.
Good morning, Councilman Tasco and council members. My name is Deb Brown, and I'm the CEO for the American Lung Association of the Mid-Atlantic region. We are here as well to oppose the bills proposed today. The American Lung Association in Pennsylvania is disappointed that Philadelphia City Council is looking to once again permit local establishments to request and receive a waiver from the Clean Indoor Air Worker Protection Law. The Clean Indoor Air Worker Protection Law was passed to protect all workers and citizens. There are many employees who are employed at the private club, gentlemen's club, and the bar proposed. By voting for the waivers, Philadelphia will undo the original intent of the law, putting numerous workers in harm's way as a result of breathing in secondhand smoke every day. Passage also sets a bad precedence of others to come forth, again diminishing the intent of the law. The U.S. Surgeon General in 2006 said there is no amount of secondhand smoke that is safe. People who breathe in secondhand smoke are more likely to become sick and die from lung cancer and heart disease. Secondhand smoke can also cause respiratory infections and asthma. The Centers for Disease Control and Prevention recently released a report saying that 58 million Americans were exposed to secondhand smoke in 2011-12, or about 1 in 4 non-smokers. The total is down to about 1 in 2 non-smokers who were exposed to secondhand smoke back in 1999 and 2000. This means that half as many American non-smokers are exposed to secondhand smoke now compared to a decade. By continuing to establish waivers in the city of Philadelphia, we will be pushing those numbers in the wrong direction as we expose more people to secondhand smoke in their work environment and consequently driving up overall health care costs. The American Lung Association has a campaign called Lung Force. Lung Force unites women and addresses the fact that lung cancer is the #1 cancer killer of women in the United States, as well as men. A majority of lung cancer is caused by tobacco use, secondhand smoke, and other environmental factors. Knowing this information, it is hard to understand why the city of Philadelphia would want to knowingly give permission to employers to harm workers. By taking a stand and permitting no more waivers, the city of Philadelphia City Council would definitely save lives. No one should have to choose between their health and their paycheck. Philadelphia needs to remain strong and support the original intent of the law to protect all workers and citizens equally. Thank you.
Thank you very much. Dr. Gambassia.
Yes, good morning. Yeah, my name is Dr. Stephen Gambascia at Drexel University. I'm a professor of health service administration. I've been affiliated as a volunteer with the American Heart Association and work on a number of tobacco control issues. And I'm here to support this panel in terms of any questions that council may have.
Thank you. Let me just say this. We passed the no smoking bill in 207. It's been so long, I can't remember. But anyway, today we're dealing with four situations that present a dilemma. So I just want to say we're trying to resolve the issues around 4 situations. This council and this committee will be looking at measures so that we won't be here again, all right? But this is not our effort to overturn the smoking bill or to increase more waivers or increase waivers. We're trying to resolve circumstances around these 4 requests that are kind of like unique. But we will be looking at measures that we can take so that we won't be here again. So please understand that. We were sincere when we passed the smoking bill, and it was a trying and tough time in the decision, but it was made. So understand that we're not here to open up Pandora's box. Thank you for your testimony. Any questions? Thank you very much. Ms. Bonnie Grant. Bonnie, we got all the information. You gave it to us before. So we don't need to eat the whole cow to know
I
it's
won't
beef.
read the
Thank
whole
you.
thing. Good morning, members of City Council. I would like to say that at this time at the Hyatt Regency Hotel, there are more than 200 medical meeting and pharma meeting planners meeting on best practices for cities, at where to choose their meeting, how to conduct their meeting, how to have content in their meeting, and non-smoking cities is a subject. My name is Bonnie Grant, as I was introduced, and since 2006, I've served as Executive Director of the Greater Philadelphia Life Sciences Congress, which is a division of the Philadelphia Convention and Visitors Bureau. Our mission is to generate economic impact and job growth by increasing the region's hotel occupancy and revenues. We pride ourselves on attracting medical and life science-related meetings. We are the birthplace of not only American history, but also of American medicine, with the first hospital, the first medical school, the first children's hospital, and more. So we commit resources to making sure that our associations and professional societies are aware of this. We are rich, as you know, in medical, healthcare, biotech, pharmaceutical, higher ed, research, and venture capital entities that often provide opportunities for long-term businesses when these kinds of conventions come to town. These meetings and conventions support more than 53,000 hospitality jobs. And as Dr. Bueller mentioned, in the fall, we announced that we have finally landed the American Heart Association's scientific sessions, which will bring 25,000 attendees and an economic impact of $68 million. We are currently being considered for 2023. We almost had a deal breaker when they needed more information on how we were as a smoke-free city, and with the health department's assistance, we were able to prove that out of 15,000 establishments, we only had 75 waivers. Increasingly, these types of meetings, which is a very coveted market for other major convention cities, are demanding not only smoke-free venues, but complete smoke-free cities. Americans for the Non-Smokers' Rights, ANR, initiated a smoke-free meetings campaign in 2004, and they are encouraging organizations to host meetings in only smoke-free cities and venues. They now have more than 30 organizations participating. They are asking groups to adopt a resolution to make smoke-free meeting facilities a priority. They provide a model smoke-free meetings resolution to help the meeting planners do it very easily. So just as meeting planners are looking for sustainable and green meeting experiences, they are increasingly looking for smoke-free meeting experiences. Other conventions that are coming up that are taking this highly into consideration, we will have the American Association for Cancer Research, which is located in our hometown at 6th and Chestnut. They are meeting here for the first time since 1999 in April of 2015, this year. And we also have the Bio International Convention, which is meeting here in June of this year. This week, as I said, more than 200 medical meeting planners are discussing this very subject. So if it is a choice between Philadelphia and another smoke-free venue or city to bring a meeting to, let's not let Philadelphia lose that business. Thank you.
Thank you very much for your testimony. Is there anyone else here to testify on either of the four bills? We have two gentlemen clubs. You going to testify? No. You don't have to. One across the street, they're across the street from each other. One has no smoking, the other one does smoking. We have a small bar which missed the deadline for applying for a waiver because of a bill owed to the water department. So that was a circumstance that we were taking into consideration. And as I said before, we are trying to rectify these situations, but at the same time not trying to open up Pandora's box for future waivers. So we will be looking at measures to address this issue, Commissioner. So today, if there is nobody else to testify, we will now go from our public hearing into our public meeting, and we call on Councilman Greenlee.
You want to do all four?
Oh, yeah. Mm-hmm.
Thank you, Madam Chair.
Oh, the other one was the private club that has no employees. It's a private club with no employees. It's on the third floor smoking room. They want to do that, it's their choice.
You want to do suspension?
Yeah.
Okay. Thank you, Madam Chair. I move that the following bills be reported out as committee with a favorable recommendation and a suspension of rules to allow for first reading next session of council. Bill numbers 140517, 140635, 140886, and 140649.
It has been moved and seconded that bills 140517, 140635, 140886, and 140649 be reported out of committee with favorable recommendation, and that the rules of council be suspended so this bill can be heard at council's next session. All in favor? Aye. Is there any opposition? There being none, the motion's carried. Thank you very much.
Losing your way and feeling it strange.